Is star 9 a mute?
I believe so.
Okay.
I think star 6 is mute and unmute.
Ah, star
I've
6.
had to use that lately.
Okay. So if I hit star 6, it's muted, and if I want to come back on, I hit star 6 again. It's like a toggle.
Yes, I believe so.
That's very
Try it right
helpful.
now.
Thank you. Okay, I'll try it. Star 6. Okay, can you hear me?
Yes.
You can hear me. Okay. I'm gonna try it again. Star.
I can't
Looks
hear
like
you
it
now.
worked. We can't hear you.
If you hit it and you get it right, a voice comes on and tells you that you're muted
There you go.
and that you can, and then you can toggle. So star 6 is absolutely correct. Thank you, Mavis.
That stops all your background noise. You can, don't have to worry
that's-
about any noise in the background.
Very helpful. Okay, now
You need
Mavis,
a
you are.
question? But
Go ahead.
never mind. I was saying something silly.
No.
You did like that
Okay,
from
so-
half, right? You like that from half. Yeah.
Okay, now when Mavis was speaking, there was no background noise, but whoever spoke just now, there was a lot of echo and stuff.
Deb, you can't stop what other people do.
Oh, okay. Well, I just didn't want to do the same thing.
Yes. So if you do star 6, then you can, walk around. You can make a cup of coffee and nobody will hear you.
Actually, I'll be like you. I'll be driving. I'm just walking to
Oh.
the car now.
Okay.
Okay. Well, thank you for the help. I appreciate it.
And Deb, sometimes
Yeah.
Blair will. Sometimes if you're making noise and you forget to mute, Blair will mute you.
Yeah, he did that with Tom a couple of times. I remember that.
Yeah. So
Now,
that's always a little embarrassing. You should mute yourself first before you annoy the moderator. But it's happened to me
Gotcha.
a few
Sure.
times. It's happened to me
Okay,
a
now-
few times.
All right, well, let's
Okay,
get
now-
started. Is everybody ready in the boardroom? Savannah, are you good to
Okay.
go?
Christine, good to go.
Ah, Christine is here today. Sorry. All right. Well, I apologize, everyone, that I am not there in person. I am on my way. I have left at a normal time and was around about 800 semi trucks and also hit a freight train. Didn't hit a freight train, but I had to wait for a freight train. So
Well,
I'm not there in the building with you at the
clarification.
moment.
I estimated on time.
Well, I don't know what happened with my traffic pattern. I should have been there, but I will be soon. So in any case, time being 9:01 a.m., I'd like to call this meeting to order of Kane County's Public Health Committee. Clerk, please call the roll for attendance.
Lewis? Shepro? Strathman?
Strathman here. Good morning.
Happy?
Tempe here.
Wallace?
Wallace here.
Silva? Sanchez?
Sanchez present.
Silva is here.
Noted. Pirag? We have quorum.
All right, if someone could please ask for unanimous consent to approve the minutes of October 19th, 2022.
Silva moves.
Silva moves, hearing no objections. Minutes are approved. Finance and budget, are there any questions this month for the Public Health Department's finance report? Hearing none, we'll move on. Public comments on agenda items. Of course, I can't see if anyone is there in person, so I'm sure you'll let me know. I don't see anyone online, so we'll move on from public comments. Health Department, Executive Director report, Mr. Isaacson.
Excellent. Good morning, everyone. Just getting the presentation pulled up. So just wanted to give an update on a couple topics that we're seeing of interest in the community right now. So starting with COVID, our average number of cases has gone down slightly, but we are looking at what may happen over the winter. We are seeing a pretty dramatic increase in influenza and RSV in our hospitals here in Kane County. As I mentioned last month, the number of cases that are being reported to us each day had been declining pretty quickly over the last several months. But the rate of that decline had slowed down. So it's kind of leveling out a little bit now. So we're getting exactly 59. We're averaging 59 cases per day over the past month. Of course, the caveat always is those are the cases that are reported to the health department. So with home tests and things like that, we don't always get it reported to us. So we know that there's more activity out in the community than that. Still encouraging people to get the bivalent booster, which is available. And then and this is potentially add some confusion, but two things that we're looking at. We look at what the CDC is calling the community level, where we're still currently in low, and community level, that term also encompasses hospitalizations. So it's what's really I look at it as what's the impact of COVID on the community. But then a second measure we look at is transmission. And for transmission, we are still in the substantial level, which is the second highest level. So there's still a fair amount of COVID going on out there. So just something that we want everybody to be aware of. Next, moving on, we are still monitoring the situation with Ebola. There is an outbreak occurring in Africa, and we do have a lot of people who travel every day back and forth from Africa. So health departments here in Illinois, we're set up where if somebody travels from the impacted area, we are notified at the local health department, and then we will make attempts to contact that person so that we can monitor them. The goal is to monitor them for symptoms for 21 days from when they left. In this case, it's Uganda. Right now, we don't have anybody who's been identified as high risk, meaning that they've had direct contact with somebody who has Ebola. But we have had 6 people who've been from the area where the outbreak is occurring. So we are currently monitoring people for symptoms. So it's something we're beginning to meet weekly to talk about this within the health department. So right now, relatively low risk, but of course, Ebola is a very serious illness. So we want to make sure that if anybody did come into our community, that we would be able to make sure that they were properly isolated if they started to show any symptoms. This slide shows what we're seeing for influenza-like illness in our emergency departments. This is 4 of our 5 hospitals that are currently participating in this surveillance. What this is showing is over the last 6 years, what we've seen. And we're, of course, at the start of the flu season. So just to kind of orient you to this slide, this is based on the number of weeks in the year. So you can see kind of on the upper left there where it says 15.2% of ER visits for our last reporting period, which was that last full week of October, are related specifically to influenza-like illness. That's one of the highest rates that we've seen over the last 6 years. So there's a tremendous amount of respiratory illness that's coming into our hospitals. You can see the other colored lines there representing the other years. You can see some years start earlier than others. So the red line, which is representing 2020 and 2021, it started a little earlier, it declined. But right now where we are is significantly higher than we typically are this time of year. There's different terms that have been used when we look at what's happening. People had worried about like the twindemic. So what are we going to see potentially after people have taken precautions with COVID? Now that we're back and around people more, it makes sense that we're going to be spreading more viruses. So there is some concern that we're going to see potentially elevated year. Of course, looking at other years, it is possible that we see a spike that goes down pretty quickly. So we're always hopeful for that. So this is something that we're meeting with our hospitals on a regular basis. We just started that up again this time of year, and we'll be reporting out, sharing any relevant information about this with you. And then in our last meeting with our hospitals, there was a lot of discussion just about the burden of respiratory illness, and you've probably seen some articles in the newspapers, and specifically with RSV, which we're seeing in more in young people, but it can be very serious in the older population as well. And we are seeing some capacity issues where hospitals are having to transport younger people farther away just because we don't have capacity locally. So that's something that we're going to pay close attention to. And the tried and true interventions of washing hands and staying home when you're sick and all those good things is what we recommend for any of the respiratory illnesses. And if a vaccine exists, which of course it does for COVID, it does for influenza, then we're strongly encouraging people to get vaccinated. And I don't know, Laura, anything you want to add to that?
No, the other thing is just the RSV.
And I think Uche, is Uche online? I can't see no, okay, very good. A couple funding updates from the health department. So we do have a resolution. We submitted a grant for Kane County to continue to host what's called the Local Advisory Council for the city of Aurora. Just as a reminder, as part of the Reimagine Public Safety Act, this is something that the state put out. They formed a new gun violence prevention unit at the Department of Human Services. And again, I thank Chairman Pirog for making sure that we were really pushing and active with this. We have been convening this group. This also allowed us the opportunity to work with local partners in Aurora, including the city and other social service organizations and grassroots organizations, where we worked with people to submit their own applications for funding. And then now there was funding that's been made available for an organization to continue hosting these meetings like we have been doing. So just last Wednesday, we did submit a grant application for Kane County to continue to be the convener of this group. We've been working, like I said, very closely with the city of Aurora, and this is a partnership. But this would be great if we could bring in a staff person to help. So we'll have a resolution, which we'll talk about here in a few minutes, just preemptively, because the state's indicating that they're going to have funding decisions for this within the next 2 weeks. And then the grant period would actually start on December 1st. So we'll have a kind of just so we can be ahead of the curve here, we have a resolution where if we get funded, we'd like to be able to accept that grant. So happy to answer any questions about that, but it's exciting. It's we're really focused on positive things around this. So there's going to be intervention where if there is violence, we're working with community groups to be able to intervene, but we're also focusing on pro-social things and mentorship and job training and getting people active and engaged in other more productive things as well. So, yes, sir.
Last week, the coroner reported there was one opioid.
Mike, please.
One death every day from overdose for the county.
Yeah, so
That's a lot.
it's a lot. So transitioning to the opioids, we do continue to see fentanyl being involved in most of the overdoses. So of course, fentanyl is a type of opioid, which is hyperpotent and something that's very scary as we're starting to see it in more non-opioid drugs. So, and this is a national issue that we're running into. People who may be using other drugs such as cocaine, not expecting it to have fentanyl, and then they have no tolerance in their bodies, and they're much more likely then to have a fatal episode. So just in a funding update, we are going to be submitting an application on Friday to the National Association of City and County Health Officials. This is a partnership where the health department is applying, but we're working with our hospitals so that if somebody does overdose, There's medication that's very effective at helping to get helping people who have a substance use disorder. That's much easier said than done. So what we're trying to do is, because somebody needs to be ready, and they need to be ready for treatment. They need to be willing to get on this medication. So with this grant funding, if we're successful, and we're also looking at other opportunities around this, we would work with the hospitals, work with local substance use providers. And actually we have our Kane County Opioid Task Force is meeting on Friday morning, where this is work that we have on an ongoing basis. But also starting to use more of the peers. So Elgin Community College is one of the educational units here in Illinois that has a program where people can be certified to be peer recovery specialists. So we're trying to do more so that we can link people, so that this may be somebody who has lived experience. So if somebody comes in for an overdose, they may be saved. And it's something that we do very actively at the health department, where we're trying to get naloxone or Narcan is the brand name, out into the community. But then once somebody recovers, it's not fun to come out once you've been saved. So your life has been saved, but you've been jolted pretty suddenly out of this. So it's not uncommon for and anecdotally we'll hear, I shouldn't say it's not uncommon, but anecdotally we hear then that people who are saved will try to get a fix as soon as possible. So that's something that we'll hear complaints about, is people. So it's very frustrating, and it's frustrating for EMS. It's frustrating for families. It's frustrating for the emergency departments. But we're talking about people who are struggling with a very, very serious substance use issue. So through interventions like this, if somebody comes in, if we can get them on this medication sooner, and we have many of our physicians in Kane County are trained to use these medications, which can keep people from getting that high. So it can help bridge to get you into treatment. And then also the peer recovery specialists are a proven way for people to connect with somebody. We can make it more likely that somebody's going to get into recovery. And this is a case where, even though it's frustrating for many of the people involved, and many people may help the same person multiple times, we know this is our friends and our family members, and people are going through this period now. Ideally, we get to a situation where we can get people help, they can get into recovery, and 5 years from now, we can look back and say, oh yeah, that was horrible when I was going through that, but now I'm back to where I'm able to participate with my family and participate in a meaningful way in society. So.
I agree with Mr. Kenyon. This is an issue that why we would have the opportunity to have medication and prevention. It's simply not enough. There are some issues here in the county that are significant, and this is being one of them, especially since it impacts, according to your data, Caucasian men of prime earning age. 25 to about 45, maybe a little older than that. So if you, and I don't know if it's something that perhaps we can work with our public information officer and give it careful, I'm serious about this, give it careful consideration and resources, whether it be grant or internal, that we can start looking at doing a public information campaign to actually have men who are either survivors or family members who are dealing with this, to get it out into the public, so that if a gentleman is facing issues, it's a like to a like. It's not a nurse saying you shouldn't do this, or a doctor. It's a person to a person. And whatever that takes, if we can save 4 or 5 lives by doing this, it's worth every dime of it.
Definitely.
In my opinion. So let's, I'm serious, if we can, let's move forward with that, put together a game plan, and then present that to the board, and perhaps in December.
Great, excellent. And we have secured some grant funding from the state to do exactly that. So,
Perfect.
So we
Perfect.
will put that on the agenda for December. Excellent.
Thank you.
And then to Mr. Kenyon's point, with fentanyl being so incredibly dangerous, the coroner has reported an increase. So what we do in those situations is try to get that information out. to make sure that people are aware that they know there may be fentanyl in the drug supply. Of course, it's all over the place now, but when we do see spikes, we have over the past 2 weeks seen this dramatic increase. We are rolling out a new texting service where we can actually text information to people in the community. So when we see things happening, we can let them know so that they can be more proactive and be even more careful. So this is something we need to hit from multiple angles, but it continues to be a major health issue for us.
And if I may, is it being produced here or is it coming from other states?
China.
China.
Or different parts of Illinois? Do we know where the locations are for the
Yeah.
labs?
China is where they believe most of the fentanyl is coming from, but it's coming in typically in the drug supply through Mexico. But China is where fentanyl is, and it's very cheap to produce. And it's something that many drug dealers are using to cut their product because you can stretch your profits so much more. I've heard our law enforcement officials talk about this because in a common sense kind of way, we say, well, no, it doesn't make sense that you're going to have your customers die. That's not good for business. But I've heard Sheriff Hain and other local police department officials talk about how that's not really the mindset. And that if you have a way where you can cut the product and really extend your profits, people are going to do that. And that's why we're starting to see it show up in other things too. But it's coming in from other countries.
All right. Okay. Thank you. So that is something that we cannot control.
And we have met with our opioid task force. We do have the DEA come in and speak sometimes. Certainly, we're fortunate, as I've mentioned many times, to have Sheriff Hain is so proactive on this issue. So his team, both on the enforcement side, we talk a lot about the great stuff that goes on with treatment in the jail, that we don't want people to come back to jail. We want people to get that job training and to get that treatment. But also there's the regular law enforcement side of and where we are here in Chicago, kind of in the middle of the country with east, west and north, south major thoroughfares. There's a lot of drugs that come through here. So state police and the federal government and local police departments are working on this all the time as well. But I think for our side, from the public health department, the public information, as you mentioned, the linkages that we're doing so that we can get people into treatment more quickly. And then as we talk about trauma and other things like that, there's reasons how people first get into this. And so there's a lot of people where we talk about, hey, maybe somebody had a surgery and had some opioids prescribed to them. That's something that we're very aware of. But then there's also a lot of people who, if we were doing a better job of screening for alcohol use, that can be something that can be, if we caught it sooner, we may catch people before they get to other more serious drugs like opioids. So that's something we're looking at as well.
Yeah, to me, it's really transitioning the conversation on addiction away from, law enforcement and criminal justice and towards a public health issue.
Right.
I think the more we do that, the better the outcomes are going to be. Really, it's happening in Europe. You look at Portugal, it's amazing what they've done. They don't talk about junkies anymore. They talk about people that just need some help.
Right.
And, so I see the direction there. We're heading,
And
so.
we have two communities that I saw. I went to a health report at Sherman Hospital and recently, and it's Carpentersville, unfortunately. The other one took me by surprise is Gilbert's. One of the highest levels of fentanyl use is Gilbert's. And Gilbert's. So it's why? I mean, I'm surprised. I'm surprised at Carpentersville because it doesn't fit the demographics that we've seen. And Gilbert's, what's going on up there? It's a beautiful community. And I'm not saying beautiful communities don't have issues, because we all certainly do, different levels, but we have to hone in on it and figure out why.
Right.
And get that message out to them.
Exactly. And I think it's not just one message, right? I think to your point, it's multiple messages. So when we talk about mental health and substance use disorders and different traumas that people have experienced and different protective factors and different pressures, why a 16-year-old who may be new to this country or a child of someone who emigrated here, the pressures that they're facing are different than the 5th generation college bound student who we also are losing to overdoses, right? So I think we need to be able to work with a lot of different people in the community. And this is something I repeat with our mental health conversations is there's different pressures and different stressors and different protective factors in different areas. But unfortunately, no one is immune from the opioids and this fentanyl. So we need to get out and every family needs to be aware of this. Definitely.
Good.
Mr. Caius?
Yeah. Say, Mike, this is Caius from District 23. Maybe I missed it, but did you mention fentanyl test kits? Are we promoting those? Are we getting people to use them? Is that part of the message too?
So the harm reduction strategies that have been proven to work do include things like fentanyl test strips. So I've been working with the state's attorney's office for a while and actually working with the state as well. We're looking at potentially changing some laws around how those can be distributed. So the health department has had grant funding where we've been able to purchase them and make them available for some groups. But it's pretty tight on who can do it. So it's treated almost as dispensing a medication, even though it's not a medication. So it has to be a nurse or a doctor or somebody who's doing it. This is something that's it saves lives. And so when you get into harm reduction, certainly people have different feelings about how that works. But if somebody who is not expecting to have fentanyl can find out that there is fentanyl, that may save their lives. That may give us the opportunity to get that person into treatment, which may save someone's son or daughter, brother, sister, whatever. So fentanyl test strips, I think, are going to continue to be more of part of our strategy, but we're working through some of the logistics on it right now.
Ms. Gums?
Mr. Chair. I have a quick question. I recently had a conversation with our coroner in reference to this fentanyl issue. Are you finding that there are batches that are bad? Can you pinpoint that from the data that you're analyzing?
I don't have the ability to identify bad batches, but what we can see is when we monitor what's going on in the hospitals every day, and we have set triggers when there's an increase in overdoses that literally we get an alert from, this is a computer system called Essence that we use. So this is nationally, this is something that we're trying to figure out the best interventions. When we see a spike, we communicate that to all of our partners. So that can be to police departments, EMS, so that they know, hey, you may see more overdoses in your community. It could be because there's a bad batch, but we don't necessarily, I can't pinpoint that. I just see the negative impact of it. We also send it out to our harm reduction partners who are directly working with people who are active drug users, so they can get the word out to people who are using drugs to say, look, this is going on in our community, so you need to be extra careful. And then as we talk about when people get released from jail, there's typically a higher fatal overdose rate because somebody's been in, maybe they haven't been using drugs. Then when they get out, they try to use what they were using before, and that may be too much. So just making sure that everybody has the information so that they can make the best choices for the situation, even though, again, ideally nobody's using, but that's not reality. People are actively using these drugs. So how do we keep them from dying? So we're getting better systems at that. And that's part of this tech system, is trying to get information out to people as quickly as possible when we see elevated numbers of overdoses.
Thank you. And the reason I asked that is the coroner has agreed. I've recently had a meeting with one of our local drug dealers, and he and I are going to sit down, and the coroner also will sit down in a private setting, because when they are aware that there's a bad batch, it's on their onerous to pull that batch. They have the ability. I mean, they're an organization. During this conversation, I said, we have drug-induced homicide things that we are charging drug dealers with, to which that didn't go over well. But regardless, it's a multi-pronged approach. And I think if we leave out that aspect, we are missing an opportunity. So not everybody's comfortable with talking to folks like that. I am. And the coroner's agreed to do that with me. But I think, as horrible as it might sound, we need them to say immediately, hey, let's pull this batch. And they have that ability. And that will ultimately save lives. It won't, like you said, it's not going to stop people from doing drugs, but when they know they have that bad batch, I'm asking that they immediately pull that. So he was receptive to that. So.
And that's reasonable. They're a major link in the chain and we can't act just because they're, you know, that status that's beneath us. We got to face the reality if we're really going to take addiction on.
And substance use has always been part of society,
Yeah.
right?
Sure.
And prohibition has never worked. So we need to find ways to Chairman's comments. We have to find creative ways like you're talking about. So let me know how we can help with anything like that.
Very good.
So this is, I'm sorry.
Madam
This
Chair.
This is amazing. Thank you. And both of you are absolutely spot on, correct? All three of you, that this is something that predates all of us. It's been a normal aspect of what people do to try to remove stress and tension in their bodies or anxiety, whatever it may be. And they have their particular poison, quote poison. But actually going to, well, it dates back decades since the start of mankind. But actually going to the distributors, and this is something that I don't think that we can certainly advocate for on the local level, but perhaps state level, certainly federal level, to remove this from being a felony to not legalizing it, but very much as the approach of cannabis, where it becomes quietly approved and then, in my opinion, still has to be adopted separately. I think the darn stuff is too strong for common use. But this is something that is a different, unique approach. So I applaud you for your efforts on this, Ms. Gomes. I truly do. Just cautious. Just be cautious. and
Always
that's
cautious,
always
yeah.
Cautious.
It's another constituent.
Yep. Sometimes he didn't like what I had to say, but you know, I grew up with half these folks, so.
I see Mr. Wallace has his hand up. Mr. Wallace?
Thank you. I have a question. What is the legal limitation on distributing these test strips in the educational setting? So like through high school, being able to distribute them in mass to students who, you know, may or may not be coming into contact with these batches.
Yeah, that's an excellent question. Thank you. So we're still working through some barriers with that. And when it comes to the educational setting, I think just in general, even with something that's potentially less controversial than fentanyl test strips, even with naloxone, sometimes we run into barriers in the educational setting, getting that out to people. So it's something we're actively working on, and I don't fault anyone for this, but I think sometimes people still like to say, well, we don't have that issue here in our confines, or maybe that's not our problem. So for both naloxone, we continue to work to get more of it in schools. And this is not only our public schools and our community colleges and universities, but also as many employers as we can. I think, and this is not necessarily a positive thing, but it's a reflection of reality. We really are in a place where we'd like to see something like naloxone as readily available as AEDs that are used for heart attacks. So this is just another way that you can save a person's life if you see them struggling. It's just effective, it's safe. We're still working through some of those fears that people have about it. There's especially with the naloxone, there's not issues with people being liable or anything like that, and Good Samaritan laws protect people. So we're trying to push there. But I bring up the naloxone just back to your direct question, Mr. Walsh, because there's still some hesitancy and some barriers with the fentanyl test strips. I think we're going to continue to work through those as time goes on, but we do need to make some changes in Illinois law to make it a little easier to distribute them.
And I guess in follow up to that, would it make any sense to be working directly with the school boards or with superintendents to try to encourage at least some discussion at the school board level about whether something like this could be done?
Yes, absolutely. And we do work closely with the schools on these issues, but I think you're absolutely right. Engaging school boards is a good strategy.
Any other questions or comments before we move on? Okay, it's a good conversation. I know we're going to be addressing this topic until we
For
don't need
several
to
thousand
anymore,
years.
really, until we can transition to a better way of handling it. That's healthier.
Right.
All right. Do you
And
have a couple
last
more
slide, I'll
things?
just share actually, right now, we have a communicable disease conference that's going on. I mean, right now, like at this very minute. So we have about 100 people who are involved from our hospitals and our schools who are joining our staff, who put together a great presentation. So on the left, you can see one of our assistant directors, April Elliott, is one of the key speakers. And then we have some great folks from the state who are joining us, sharing information about rabies, STIs. And then we have a special guest talking about some different things in epidemiology that are being seen. So look forward to joining that after committee's done here today, but a great way for us to get information out to the public so that everybody has the most up-to-date information on these different health issues. And then on Thursday, we have a health equity retreat that's going to be occurring. So we're looking forward to that, talking about how we can make sure that our services are meeting the needs of all of our residents. So we're going to be sharing some data that we have, and then also engaging. We have a great speaker from UIC who's going to be coming out, sharing some things that she's seen. So this will be an in-person meeting at the Forest Preserve building there in Wayne. So I'm excited about that. And this is just the first of many things I think we're going to try to do to engage people. And then, as I mentioned last month, we are going to be doing more community engagement things. I wanted to wait for the election stuff to die down a little bit so that it wasn't too political in these discussions, that we could really focus just on what's going on with issues in the community. So over the next month, we'll be inviting the public to join in those. So
Excellent. And I know there is a request with the ARPA committee for the health department on a health equity component, and that's being put together. So is this a part of that, or this will just kind of connect to that?
It's all
eventually?
tied together.
Yeah.
Yes, sir. Yep.
Excellent.
So we have with the ARPA request, we're looking kind of specifically at some chronic disease issues, but we don't have chronic disease people, substance use people, mental health people. We're not split up like that, right? We have residents of Kane County, and frequently people are struggling with multiple issues, or there's multiple barriers to getting them the right information. So we're trying to knit all of our services together. And that's why things like our IRIS electronic referral system are so important, so that there can be kind of that no wrong door approach, where wherever somebody in Kane County goes for services, we want to make it as easy for them to get what they need. So whether that's making sure that we're getting services that match a person's language and culture and things like that, that we're going to where people are. But also when we have that conversation with people, we may find out that they need help with their rent, or they're having trouble with getting enough food for their family, or there may be some educational issues. So making sure we have the ability to quickly connect people with different services.
Excellent. Any questions or comments? Okay. All right, we do have two resolutions. So I'll ask for a motion in a second. The resolution authorizing extension of COVID-19 investigation and resident call center. If anyone would like to move that.
Strathman will move. Silva seconds.
This is Strathman and Silva. Okay, this one is it's kind of it became a sort of a time sensitive issue. I think normally it would have started in the ARPA committee, but we decided at this point, I'm kind of wearing two hats. We decided it'd just be best to get it done as quickly as possible, partially because we don't have yet an approved budget, and we want to make sure we can align with that very easily. And also just to ensure we have a contract in place with services for COVID-19 contact tracing and call center, so that we can ensure that payments are sent out on time going forward. So that being said, this is just, it's contemplating a 1-year extension of our contract with KPMG. We're not anticipating that need, but instead of coming back every month for another extension, we just thought it's best to do 1 year. As soon as the COVID-19 contact tracing mandate is removed from the state, the plan is, the intention is we will pull back from that and go back to our normal call center type activities, which were pretty minimal before COVID. You did have your occasional Ebola monitoring, tuberculosis outbreak in, a neighborhood or something like that, but it was pretty quiet. But because of COVID, we're now seeing extremely high numbers of RSV. That's something that is being monitored by us and other communicable diseases as well, things that are increasing the demands of our normal call center, which was handled internally quite well before COVID. But right now, if we get rid of COVID contact tracing, we're still going to need some of these call center services because of COVID. So this resolution includes all of that. And assuming COVID-19 contact tracing is ended at some point, let's say in the next few months, we'll still have a need for the other call center because of COVID. So we're contemplating adding an amendment to this resolution that will probably have to come forward at executive committee. That would just indicate, if contact tracing for COVID-19 ends, we'll extend the call center for other services another 90 days or so, and just have an opportunity to monitor it at that point and decide if we need to extend it or not. Because with ARPA money, it does have to be related in some way to the pandemic. So that is where we're at with this. Sorry for the mouthful of that. It's very simple. We're just making sure we're providing the mandated services that we need to, but there's all these moving pieces to it. So, Madam Chair.
Could we see it? We have
Oh,
the
yeah.
slide for the
Can you
retreat.
pull up the resolution, the first one. 5B.
Mr. Chair?
Mr. Tepe.
Yeah, I just wanted to ascertain, are this coming from existing funds, or do we have to go to ARPA for more funds?
Yeah, so the original request for contact tracing using ARPA funds was somewhere around $4 million, and we have not exhausted all of that. There's about $2.5 million left out of that. And so this is contemplating just kind of rolling over those funds into this new resolution. And we're still anticipating we'll spend nowhere near the amount that's left. It's just about $2.5 million. But we just want to have it covered just in case.
Understand, but does this require approval from the ARPA committee or just approval from the executive committee and the board?
Well, the state's attorney encouraged us to get it done on this time track instead of waiting for the next ARPA committee meeting. Normally it would start in ARPA, but because of the time sensitive nature of it, we're recommending that we do it now.
Mr. Chairman,
Ms. Bates.
and it's already gone through ARPA.
Yeah, I mean,
because we approved that
this
amount of
was
money.
something that was approved previously. So the state's attorney indicated that because of that, you don't really need an additional, verification, assuming that, we're all going to be voting on it all anyway.
Sounds fine.
We try not to do it that way, but in this instance, they considered it necessary.
And we're still adjusting to the new system, so I apologize how difficult to read this is formatting wise. It looks dense, so we're trying to figure out how to get a little more white space in here so it's easier on the eyes.
Typeface and spacing, it's important. It's just easier on the eyes. Mr. Tepe, did you have another question or comment? Sorry, I thought I might have heard you. Okay, if you do, just
No, that's satisfied. That satisfied my questions.
Excellent, thank you. Any other questions or comments on this resolution? Hearing none, clerk, please call the roll.
Lewis. Shepro.
Shepro, yes.
Strathman.
Strathman, yes.
Tepe.
Tepe, yes.
Wallace.
Wallace, yes.
Silva.
Silva, yes.
Sanchez.
Sanchez, yes.
Passes.
Okay, we have a resolution authorizing acceptance of fiscal year 23 to 24 IDHS Greater Illinois Violence Prevention Council Coordinator Grant. I need a motion and a second.
Silva moves.
Silva moves.
Strathman
Wallace,
seconds.
second.
Strathman seconds. We're just trying to take some money, guys. Right. Let's do this. Mr. Isaacson, can you describe this one briefly?
So again, we're just trying to be ahead of the curve here. This is an application that we just submitted. So we don't have affirmation of funding yet. So of course, if we don't get funded, then this resolution will become moot. We won't move forward with any of this. We do feel quite strong that we will be funded. And as I mentioned, the state is indicating that December 1st is when they will be making notifications, and it's when funding will start. So otherwise, looking at the timing of committees and things, we'd be a couple months into it. So we just want to preemptively get this out and get approval to accept it if we are awarded.
Madam Chair.
I think I spoke with you about, but if you could just reference it again, pending receipt of the grant, award of the grant, that individual that you'll be hiring, it's a new hire, and they will be in residence at the health department.
That's
Is that where
correct.
their office
Yes.
is going to be? Okay, very good.
And so this person would be responsible for convening this local advisory council, which is something that's been set up in about 20 communities around the state of Illinois. So we would be responsible for the Aurora group. Although I think there's going to be some things that are going to benefit many communities in Kane County, definitely.
Absolutely. Very good. Excellent. And the spillover, what best practices are put in Aurora can be replicated easily all over.
Exactly.
Excellent.
Any other questions or comments? Hearing none, clerk, please call the roll.
Lewis, Shepro,
Pepperell, yes.
Strathman,
Strathman, yes.
Tepe,
Tepe, yes.
Wallace,
Wallace, yes.
Silva,
Silva, yes.
Sanchez,
Sanchez, yes.
passes.
Okay, thank you for that. Next, we have animal control. Brett?
Good morning, everyone. All reports are on file. If you have any questions, please let me know. I'm always here to answer them. We don't have much this month, so we're very quick and short. We're starting the process of updating our county ordinance. It's over 8 years since it's been updated to match the state. So we're starting that process with the state's attorneys now, and hopefully I'll have that in a month or two to bring before everyone. Other than that, that's all I have.
Sounds good. Any questions for animal control? Madam Chair?
How are you doing? How are the animals?
Wonderful. The good news is as winter's rolling in, our population's starting to dip, which is what we're always excited about because this is our chance till about March when kitten puppy season starts to kick off again, to get updates into our shelter. So we just had our offices painted. We have some construction work about to begin on our refrigerated unit. It's going to become a freezer unit. So this is a great time for us to start catching up. And that's why it's a perfect time to work on the ordinance and things like that, because in the middle of summer, it's just too hectic with everything going on to get on top of these sorts of projects. So we're excited to get some of our building work done and straightened out so we can prepare to go right into kitten and puppy season.
And are you also seeing, because of the costs of everything, that there are more animals being abandoned or just relinquished because they families feel that they can no longer take care of them financially?
It's the financial burden along with the return to work from COVID-19. At the beginning of the pandemic, a lot of animal shelters were so excited to see animals being adopted, and now we're seeing that push back into the shelters. That's where recently our owner surrender appointments are booked out all the way until January, February of next year, depending on the species. So yes, it is a large push of people that are surrendering animals right now, that are abandoning them, that are releasing them. But usually as we go into winter, those numbers start to dip a little bit. So we're hopeful that they continue to stay down so we can get work done. But again, it's going to be, this is a new period for a lot of us that this push back into the shelters is occurring. So we're going to kind of take it in stride as we do with everything. Like we brought in 9 kittens yesterday. So they're still coming in. Animals are always going to continue to come in. It's just a matter of, is it going to be the large influx that we have in the middle of the summer, or is it going to be our decline that we normally see through our winter months here, this 3 to 4 month period?
Thank you.
Ms. Bates?
I know we offer shots. Do we offer neutering?
We do not. We don't have the facility for that. So there are some great groups like Fox Valley Animal Welfare that does low cost spay neuter. Anderson every so often will offer low cost spay neuter. So we do try to provide those resources. They're all available on our website at kanecountypets.com. We encourage everyone to go there. We put all resources, low cost vaccine clinics on those sites because Aurora once or twice a month will offer low cost vaccines. Anderson every so often will offer low cost vaccines. So we try to make sure we keep all the resources in one location for anybody that needs them. So if people check our website, again, that's kanecountypets.com. You can find all those resources available of everything in our county.
Can we come visit?
Always. I love when people come visit.
I was gonna say, you mentioned puppy and kitten season, so if you could kind of notify us when that takes off. You know,
Of course.
maybe just put them all in a room, like, and we just hang out there. Yeah, it'd be therapeutic. I think.
Was recently there for a visit and I didn't want to leave,
Yeah.
but I don't know, a couple months ago, but yeah.
Yes, I encourage everyone to please come visit if you've never seen us especially, or if you're just having one of those days you need to play with some cute cuddly animals, please come in. We have a cute bunny right now that'll be going up for adoption shortly. So it's a great time to come visit.
So I should stay away.
Yeah.
I was very lucky to leave empty-handed.
And-
Yeah.
All right, any other questions or comments? All right, well, thank you, Brett.
Thank you.
Appreciate it. And we have nothing for old business that I'm aware of. Unanimous consent for reports to be placed on file. Someone ask for that.
I so ask, Mr. Chairman.
Shepro asks, thank you. No objections. The reports are now on file. No need for executive session and well, we already covered new business and public comments. So I just need a motion and a second to adjourn.
Motion to adjourn, Shepro.
Shepro.
Wallace second.
Wallace seconds. All those in favor say aye.
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 Thank you all for being here.